Arizona's family, we are tracking the vaccine, answering your questions tonight. The U.S. could have 240 million doses of the vaccine by the end of March. Pfizer and Moderna have pledged to have a combined 222 million doses available for shipment. Johnson & Johnson, which, by the way, has not been approved by the FDA yet, has pledged to have 20 million doses available by the end of March. Approval for Johnson & Johnson, we're hearing, could come as soon as this week. And tonight, there are new reports that you may only need about one dose of the Pfizer and the Moderna vaccines. And joining us tonight is Dr. Ernst von Schwarz, a medical researcher and cardiologist. Doctor, thanks so much for the time tonight. Good to have you here.
Thank you, Brandon, for having me.
Doctor, if the efficacy of just one dose of the Pfizer vaccine is about 72%, why not just give everyone one dose of that vaccine? Would that get us to herd immunity faster rather than giving everyone two doses?
Well, thanks for asking this. First of all, of course, one dose is better than no dose. But the initial studies were conducted using two doses, which then created the type of immunity we want for the large population after or within 4 weeks after the second dose. On the other hand, we know by now that even a single dose creates some degree of immunity by some degree of antibody production. So right now, the recommendation is still, if you can get the vaccine, get two doses of the two ones which are available. There's a difference in patients who did recover from COVID because they have some inert immunity, because they have built some antibodies, which might not be enough to fight subsequent infections. But if someone had COVID before, a single dose might be enough. And that is what several researchers consider doing right now.
And doctor, how can we be so sure? Is there enough data? How is this being figured out, the effectiveness so soon? We're not even a year into getting these vaccine shots.
Well, right now we have real-world data. In contrast to the initial study data from Pfizer, BioNTech, and Moderna, which tested basically 30 to 40,000 people with the vaccines and had some clinical follow-ups and lab tests. Now we have real-world data, especially from the UK and from Israel, what happens to the real population if we vaccinate them. And as you probably know, Israel has the largest number of de capita vaccinations performed so far. More than 50 or 55 per 100 inhabitants have received the vaccinations. And looking at the clinical follow-ups, it shows that, number one, the initial study data were confirmed that the vaccination significantly reduces severe disease, meaning hospitalization and death. But also now there's newer data, as of the last 2 days, that the transmissibility might be reduced. And that was always in question. If I get the vaccine, and I did, for example, I might be protected, but theoretically, if I have the virus, I still might be able to transmit it to someone else who's not vaccinated. So there's now some early real-world data that the transmissibility might not be completely prohibited, but significantly reduced.
And good information right now. I feel like my medicine cabinet has turned into a vitamin cabinet. Loading myself up on vitamins. Dr. Von Schwarz, I'm sorry, we're going to have to cut this interview a little short tonight. Hopefully we'll be able to have you back on to talk about some of the other things that we could all be doing right now to help build up our own immunity as we wait to get the vaccine. Dr. Ernst von Schwarz, thanks for the time tonight.